Russell-Silver syndrome. So I've got kind of three parts, and I'm going to do a slideshow to review some questions, and then I've got a little activity for you guys. So Russell-Silver syndrome is a disease that really inhibits the growth of children, both height-wise, and it also inhibits their development because of many factors that have to do with the growth. So things that you can tell from children with Russell-Silver syndrome on the outside is that they have they're very, very petite, very small, and very, very thin because they don't really get hungry very often. The way their head shape is that they have a larger forehead, and they have triangular feature, kind of the larger forehead and then a pointed jaw. They have asymmetrical growth, which means that it can be really extreme to where, like those feet, where one side is much larger than the other, or it can be just a slight difference in the skull size on each half, or just anywhere in the body, where one arm is longer, different lengths of fingers, and things like that. Children with this disease also suffer from a lot of internal issues because of the growth. These children do have the growth hormones that they need, but their body doesn't know how to utilize them. And so these kids have a lot of kidney problems, a lot of digestion issues, and just a lot of issues that are caused by the growth problem, not necessarily caused by the syndrome, but the syndrome, the problems that are caused by the syndrome causes other problems. So this is a graph of the growth rate. As you can see, the top one is the normal growth, and then a child with Russell-Silver syndrome has a much lower growth on average, and which can differentiate just because different kids are affected in slightly different ways. Like one kid might have even more of an inhibited growth than another, but it can on average it's greatly. So basically what Russell-Silver syndrome is, there's only two reasons that have been found that it's caused. About 30% is on chromosome 7, and then another that on chromosome 11. On chromosome 11, it has to do with hormones, and it's a thing where a child gets extra growth inhibitor rather than growth promoter, so it's just it's extremely inhibited instead of being balanced. And it's the same idea on chromosome 7, it just affects different ways of growth. Where chromosome 7, it has a maternal UPD, which is where children get, instead of getting, again, a growth inhibitor from the mother and a growth promoter from the father, gets twice the inhibitor without any promoter. So basically most children, they do not know what is done. Like over half the kids diagnosed with Russell-Silver syndrome, they have no idea what the cause was, whether it's from a parent or just randomly happens. It is genetic, but most children really have no idea. And that's where Magic Foundation it helps out, because Magic Foundation is one of the few places that have help for Russell-Silver syndrome, because there's little to no research going on, because it's not a very high priority to help, I guess, a lot. Since it's such a small minority, it doesn't help a huge group of people. So basically, I talked to Dana Carney, who is a parent of a child with Russell-Silver syndrome, and she also runs the Russell-Silver syndrome part of the Magic Foundation. And she was telling me that they have done some research, which was about 5 years ago, and that's how they found out that most kids with Russell-Silver syndrome they have no idea what the cause is. And then she also told me of some popular treatments for children with Russell-Silver syndrome, which one is a G-tube, which is just a feeding tube that goes in the throat, and this helps a ton for children. It's become very popular, and increasingly popular over time, because as kids are younger, they don't get hungry, and so they fight eating. So this way they get nutrients, and at least this helps them grow and develop, compared to children that are untreated, where they won't eat, so they won't get the nutrition needed. Growth hormone therapy is also a very popular treatment among Russell patients because kids with Russell Silver syndrome, even if they don't eat, they're just very naturally, they're just extremely weak. They have less muscle mass, and they're just really frail. So growth hormones help them both grow vertically, but also helps them strengthen what they already have and what muscle they need and everything. And then what was unique, Dana told me that since they don't really have any specific drugs for Russell Silver syndrome, since there's not research going on, she told me about breast cancer drug Rimidex, which is what her daughter takes. So it's meant for women with breast cancer, obviously, and it blocks estrogen actually because kids with Russell Silver syndrome, they often their bone plates fuse too early, and they'll go to puberty extremely early in life, and so to kind of allow their kids to keep developing, because once the bone plates fuse, they can't keep developing as well, so that helps make the other treatments more effective. So then, do you guys have any questions so far?
Does it affect the children mentally at all?
Yeah, so it can affect children mentally because it can cause learning disabilities, like what she told me. I think her daughter has ADD, so it's things like that. It just inhibits learning as well. But with these other treatments, you can help kind of slow down the things that are hurting the kids and try and develop them more easily. So in groups of 3, I want you guys to assume the role of 2 parents of a child with Russell Silver syndrome and a doctor. And what I want you to do is I will give you the info sheet according to which role you're playing. So one parent is for Russell Silver syndrome treatment, the other is against it, and then the doctor is there to help out and kind of give help to the decision being made. So depending on what role you play, you'll have 5 minutes to kind of look over the data. If you have any extra questions for me, I will answer them. And then you guys can kind of get together and debate, and then we can kind of talk about what you do. So if you guys want to get in groups of 3, I'll give you guys. After we talk it over a little bit, what do you guys think? Do you think that you would treat your children, or you would not? You would leave them untreated?
Well, yeah, we have decided to go with the treatment option because we decided, although some of the prices can be high, we decided that it's still feasible for our family, and with the side effects, we've chosen to embrace the risk because, there's still a chance that their child could be unhealthy again.
And we would choose Rimidex because it's cheapest and it has the less complications and side effects. So do you think that would be enough for your child, or would you? Hopefully. Or what do you think of any of the other options?
G-Tube would be second option because again, price is cheaper and it also doesn't have super bad effects.
Awesome. So what do you guys think?
We're leaning towards treatment. We probably do growth hormone therapy and G-Tube just because we think cost-wise, the growth hormone is probably a little more effective than just the Rimidex, and we can get rid of the Rimidex to save some money. And the G-Tube doesn't have that many complications besides infections, so I think those would be treated. And the growth hormone therapy would help them lead a more normal life.
And also, accessible.
No, you guys can talk freely.
Okay. Well, having the G-Tube, you say that they don't want to put on appetite, they don't want to eat in certain times, so it would be helpful to have the G-Tube during the times that they're more, and once they get a better appetite, then it's better to switch to the next.
Yeah. You guys have anything to add?
anything about the concerns of any of the treatments, or?
We were thinking that the growth hormone therapy was, due to activity problems, there's something with the growth.
So it's pretty safe.
Yeah.
And it's, I don't know, we don't know if like, those are, possible complications, we don't know that